Welcome to the new Toxins in Aesthetics presentation. During this, we will discuss some new toxins that are coming up and also look at how they may influence our practice in the future. New toxins are coming. It is almost like the charge of the Light Brigade. There are several toxins either on the market or in development, and it is important that we understand where they will sit within our current practice. We are all familiar with the big three names of toxins within the market. Botox was previously known as Vistabel for aesthetics or Botox for cosmetics, is now back to its original name of Botox. Azelur, which was an offshoot of Dysport, and Bocature, which is the offshoot of Xeomin. These three are the major toxins available on the market at present. The foremost toxin that is leading in the market for new toxins is actually a Korean-derived toxin known as Nabota. This has been renamed Juvia or Evolus and has got through the Canadian FDA and US FDA authorities. It is currently undergoing regulatory compliance within the EU and will soon be available for EU and UK use. The exact dates will be determined shortly. This toxin, given the name prabotulinum toxin, has similar primary endpoints in terms of non-inferiority when compared with the market leader Botox. This is the data directly from Evolus and is held on file. There are, however, some issues that need to be considered with this toxin in terms of market penetration, how it will compete with the other toxins on price, and currently there are some legal challenges that have been going on in the background regarding this toxin from its inception and even currently as an ongoing issue. Another toxin that is leading the charge is daxibotulinum toxin. This has been developed in the States and is currently undergoing studies before its market release. There are some interesting aspects regarding daxibotulinum toxin. Initially, it was developed by Revance as RT001, which was a topical toxin with a specific topical delivery mechanism. Subsequently, this has been converted to an injectable toxin, RT002, and one of the concepts behind it is a unique agent with an excipient which is designed to stabilize the toxin, binding with negatively charged areas. It has no animal-derived components or human albumin compared to the other toxins. So how do these relate to clinical use? The studies released to date are the Belmont studies and the Sakura studies. These appear to indicate that this particular toxin, that is daxibotulinum toxin, has a longer effectiveness compared to its rival botulinum toxins that are on the market. There are some discussions whether this is actually a true result or is due to a dose-dependent mechanism. As you can see, some of the results are on 40 units and 60 units, and hence you would expect to see a longer term result. These are, however, preliminary studies, and we await the developments in the future. So this new toxin does have some unique properties. We will need to see how this will translate into clinical practice and whether it gives us the longevity that most of us are searching for. While we were discussing topical botulinum toxin with daxibotulinum toxin, it is interesting to note that there are other companies that have looked at topical delivery mechanisms. Anterios developed its own topical delivery mechanism and its own botulinum toxin A. It is interesting that Allergan in 2016 bought over Anterios and hence brought the proprietary rights to the delivery mechanism as well as another botulinum toxin, which is now in their databanks. Transdermal Corp in the US has also been developing a topical carrier, but this has not come to any clinical use. And Malvern Cosmeceutics in the UK have also looked at a topical delivery mechanism, but again has not come into clinical use as yet. So it looks unlikely that topical botulinum toxins will be available in the near future. Another Korean toxin developed by Hugel, otherwise known as letobotulinum toxin, is also in close running to be developed and presented to the Western markets. Chroma have now taken on its development, and this looks likely to come into Europe and the UK very shortly. Hutox is another Korean toxin that is also in development. It's undergoing phase 3 trials, and Huon's Corp will probably release this in the near future. These Korean toxins are all led by biotechnology firms that are falling over themselves to develop new toxins in the future. So far, I have only discussed the Korean toxins and toxin developed in the US. There are, however, other toxins developed in other countries which are used specifically for clinical use but not aesthetics. Toxins such as Relatox, developed in Russia, and Chinatox in China, have also got their uses. However, some of the toxins have other excipients, such as gelatin, which can cause problems, and therefore may not make it into aesthetic practice in the future. It is, however, worth knowing that specific countries have their own toxins which may be used in that arena. Meditox is another Korean company that has been leading the way in developing its own botulinum toxin A brand. Neuronox is a botulinum toxin A that is in powder form. Inatox is its own liquid injectable botulinum toxin A, and Cortox is its botulinum toxin A, which is a pure botulinum toxin without the complexing proteins. In an interesting twist of fate, Allergan in 2013 bought over the distribution rights and proprietary rights of the Meditox brand. So Meditox can trade in the Far East, and Allergan has the rights to trade it in the West. How these toxins will progress in the future remains to be seen. However, the liquid injectable toxin has always been present, and that some of us will know as Myobloc, which is a botulinum toxin B. There are other injectable toxin A's in preparation. In September 2018, Allergan announced a phase 3 trials of its liquid injectable toxin, and Galderma have their toxin QM114, which underwent phase 2 trials in 2014 and is in development for release in 2021 onwards, and we await to see how that will progress. But it is interesting that liquid injectable toxins will soon be available on the market. Finally, we have to look at some new technology. Ipsen have looked at using E. coli with genetic modification and recombinant technology to produce their botulinum toxin A. The type E toxin has also undergone a resurgence of interest. This was first described way back in the 1930s, but it is purported to have a faster duration of action, although this does not translate into clinical practice when compared to the toxins that are already available. There is also a potential that this requires higher doses and also will carry a higher protein content, which if used over a longer term may have some adverse effects. We looked at market penetration earlier on. As an example, Neuronox will be available in China in the latter part of 2019. Its market strategy is to enter the market with a low price offering. If you look at the prices of botulinum toxin in China, Botox in China retails at around $460, whereas in the US it is around $309. Other botulinum toxins in China retail at about $309. Neuronox is planning to enter the market at $88, as it is in Korea. If you look at the Korean market, so the Korean toxin market is of major interest. This shows the position in 2006 compared to 2017. In 2006, Allergan had a market share of 76% in Korea, with Meditox at 8% and the other companies at about 16%. In 2017, once the Korean companies had launched their toxins and were offering it at a lower price, the Allergan market share was down at 36%, Hugo at 38%, and Meditox at 16%, with the other new companies taking an overall 10% market share. This shows the change in the market share, in particular with the lower cost offerings that the new companies have brought to market. So we see there are some interesting developments in new toxin in aesthetics. There does not appear to be any change in terms of the efficacy of these toxins, and the new toxins may not have the full range of approvals for all areas of interest in aesthetics. There is, however, a cost implication, and how these toxins will perform on the market, given that they may come in at a lower price, will be of interest to us all. I hope this will give you all an idea of some new and exciting developments, and we would of course be delighted to have further discussions with you if you join us on our training courses.